Thank you for watching this edition of Pagosa Local News. I'm here today with David Shaeffer from Pagosa Medical Group. He is the co-owner and surgeon here. Tell me about your background and how it's prepared you for responding to coronavirus.
So I am a physician, but in addition to that, I went on and did postgraduate training in surgery, which has nothing to do with infectious disease or COVID. But after that, I did go and get a master's degree in public health, and which is a 2-year degree, and that was focused on epidemiology, community response to emergencies, things like that. My specificity was on colon cancer, but we had to do a lot of the core classes in epidemiology and public health, and so that's a lot of the stuff that has sort of made me public health minded, more so than most physicians are, I think, because when it comes to an infectious disease epidemic or pandemic like what we're going through now, you can't just think about the patients in your office. You have to think about all the patients at home and think of the public's well-being, not just, again, the patient that's in your office. So that was sort of the additional training that I had and expertise that I have that sort of made me really start to tune in when I started to hear these news reports coming out of China back in whenever that was, December, January, when we started to see these cases pop up.
So who are you coordinating with locally and in the state to respond to the coronavirus?
So the most direct link we have for coordination is with San Juan Basin Public Health. And for those people that don't know what that is the public health authority here in Archuleta County, which is also the same group that manages the public health in La Plata County. And so when this epidemic started to take off, we coordinated with San Juan Basin Public Health, which is a direct extension of the Colorado Department of Public Health and Environment, otherwise known as CDPHE. And so we started on conference calls with San Juan Basin Public Health 2 weeks ago, email chains, what are called health alerts, which are emails that go out to physicians and other agencies in the community when there's important information that comes from the state health department that needs to get disseminated to medical providers and other emergency responders.
And so why is it so important to have like a coordinated effort right now?
So right now with COVID, the most important thing, at least in this region of the country and this region of the state, is we need to know if we have patients who are infected. Because those patients, A, they need care, but we also need to contain them and quarantine them and find out who they've had contact with so they don't spread it to other people in the communities. But just in general, we need to know where the hot spots are. We need to know, for example, today, that as of today, there are no confirmed cases in this county, and there's no confirmed cases in La Plata County. So we're still in this planning stage, this preparedness stage, or surveillance stage where we're really actively looking for patients that may have this infection and trying to test for them.
And so also you were talking about how just information about coronavirus is changing from day to day.
Right. So one of the big pieces of information that changes almost by the day, if not the hour, is who's really at risk, A, of infecting or getting infected with coronavirus, and who's really at risk of getting sick and possibly even dying. And what we know now, and this is really just in the last few days, we know that there's a correlation with age. So kids, younger people, they can get sick, but it's usually mild symptoms. But as you get older and as you accumulate more health problems, say lung disease, smoking, heart disease, or if you have like cancer or you're on chemotherapy, the risk of you getting sick and dying from this disease goes way up to the point where if you're over the age of 80, and even if you're healthy, the risk of dying if you contract COVID-19 is approximately 15%.
You were talking about how similar the symptoms are to the flu, and just how the flu is still going on. And so people most likely have the flu, but if they have any of those flu-like symptoms, they should still get tested.
Absolutely. So the flu is a lot more prevalent right now. We're talking about seasonal influenza. So we think we've reached the peak of seasonal influenza this season, but there's still a huge number of people who have it and who will still get it. And the vaccine is still available if you haven't gotten it. And we are strongly advising people to get the flu shot for multiple reasons. Even without coronavirus, we're always going to push people to get the flu shot. But we don't want people to get sick with the flu and the coronavirus, COVID-19, at the same time, because that could really not make you do well if that happens. So we're pushing the flu vaccine, but most of the people we have come in to our clinic wondering if they could have the COVID-19 end up just having the flu. And so the testing criteria for COVID-19, unless you have a known contact with somebody who had a positive test for COVID-19, we test you for the flu. And if you test positive for the flu, we don't test you for COVID-19 because that is a good alternative diagnosis. And most people really are just going to end up having the seasonal influenza virus and not COVID-19 at this time. But as more and more people get COVID-19 and we have more contact, then that risk will change. We're testing people in their cars if they went through a hot spot like Seattle, but weren't exposed to any known COVID-19 patients and they get flu-like symptoms, we're going to test them in their car. We have signs all over the building saying, and on our website saying, if you think you might have COVID-19, call us. Don't come in the building. We'll either come to your car, come to your home, and assess you, see if you're sick, see if you need to be hospitalized. Ultimately, we're going to run a flu test if we think the risk of COVID-19 is low. And that way, if you test flu positive, we're done. We treat you with supportive care, maybe Tamiflu for the flu, and keep you at home, keep you from going out and getting other people sick.
Okay. And so if someone does come back positive for the coronavirus, what are the options, or what do they need to do right now, and what are you going to advise them to do?
So that we right now, fortunately, again, we've not had any positive cases, and that's good news. So if we suspect somebody who met the testing criteria, let's say you had contact with somebody last week, in the last 2 weeks, who has come back as a positive COVID-19 case, and you're now developing flu-like symptoms. We're not testing people without symptoms. That's a big thing I forgot to mention. So even if you got exposed in the last 2 weeks to somebody with COVID-19, if you're well, we're not testing you. We're going to tell you to stay at home. That's where you see these news stories of people self-quarantining for 2 weeks, because if you do get sick, a lot of times we think you might be shedding the virus before you have symptoms. So we want you to stay at home and see if you get sick or not, and then we'll test you if you get sick. So, but if you think you might have it, you've had a known contact, we're going to go to your house or go to your car. We're going to swab your nose and swab your throat for the virus with the personal protective equipment on, and we're going to tell you to stay at home, assuming you're well enough to stay home. If you need to go to the hospital, we're going to make sure you get treatment in the hospital. But if you're well enough to stay at home, we're going to tell you to care at home. There is no treatment at this time for COVID-19. It's only what we call supportive care. So drink fluids, rest, things like that. So the problem is right now these tests have to go to Denver, to the state lab, and that can take 5 days to get a result back. So those are 5 very long days that you're going to have to endure. And in the meantime, you stay at home. You do what's called social distancing, where you talk to people on the phone, you don't meet them in person. If you do have to meet somebody in person, you stay 6 feet away and you wear a mask. And you try not to touch public surfaces, things like that. But ideally, you're at home and you're doing social distancing. Anyone that we test, we immediately notify the health department, San Juan Basin Public Health, and they get put on a list to start monitoring that. And if they do come back positive, then there's an investigative process that starts as far as contacts. Okay, who else did that person touch, interact with, that needs to be checked?
Right, okay. And so you were saying that if someone is self-quarantined at home, because of either suspected or they're positive, that you have a way to bring medicine to them if they need it, supplies, things like that. So can you tell me about that?
Right. So fortunately, we haven't had to do this yet. As far as I know, we have no patients in our practice that are self-quarantining. But we obviously would check them at their house, make sure they don't meet criteria for being in a hospital. But since there's no treatment known, it's going to be things that you already have in your medicine cabinet. So decongestants, cough suppressants, Tylenol, ibuprofen, things that just make you generally deal with the symptoms of this illness, of a flu-like illness. We're going to encourage you to stay home. If there's things that you need groceries, well, then we can coordinate or help you coordinate someone bring you food and supplies to your door, not hand them. not hand them to you, but hand them outside your door so that then you can pick them up and bring them inside.
What are some simple things that people can do right now to prevent getting ill and also prevent spreading the virus if they are ill?
So we think right now that this virus, the COVID-19 virus, spreads just like the common cold and or the flu virus. So wash your hands, number one advice. If you go to public places, try not to touch things like doorknobs and handrails. And if you do, wash your hands for 20 seconds with soap and water. Hand sanitizers are okay, they're better than nothing, but you really want to wash your hands if you have the option to. Certainly if you sneeze into your hands, then you want to wash them. Hand sanitizer is not that great in that situation. But for older people, as we mentioned before, who are at risk of dying from this disease, we're telling them now, and this is based on federal guidelines and federal recommendations, is to simply avoid public places. And that's why you see a lot of school districts shutting down, you see a lot of public events shutting down, and that is probably the best advice. We've already advised some of our more senior patients to cancel their trips because they were concerned, and we said, just don't do it. That is the safest thing to do right now, is to just not go out and travel and stay away from public places. If you do need to go out in public, you need to go to the grocery store, wear a mask, stay away from people that are coughing and sneezing. If you're coughing or sneezing, do the vampire cough, the vampire sneeze. Try not to sneeze into your hand. If you do, you want to wash your hands right away. And just awareness. And again, that's if you're sick and you go to the doctor, don't go and sit in the waiting room if you can help it, things like that.
Okay, and I also heard that, so it's no longer fist bump, it's like elbow. So should we try it?
Elbow?
Elbow bump.
Or foot.
Foot, okay.
That's my favorite, because we all assume that our feet and our shoes are dirty, and we all typically, I hope, wash our hands after we put our shoes on or tie our shoelaces. So, because even elbows, we sometimes scratch our elbow and then touch our face. So, and again, other things you can do, just avoid touching your face, which is something we all have a hard time doing. But that's another good piece of advice.
Thanks for your expertise. We're glad that you're in this community to help us, stay safer and healthier.
You're welcome. Thanks for being here today.
Thanks for watching this edition of Local News Pagosa Springs. If you would like to see this story again, visit our website at pagosalocal.news, where you can sign up to have us deliver the news directly to your inbox. If you are interested in hosting a digital network display at your place of business, you can fill out a form on our website.